Now, good afternoon. Right, good afternoon, Mr. Gale.
Thank you, my lord. Next witness is Margaret Waterton. Mrs. Waterton speaks to two statements. The first is SCI WT 0237 and 501. The second is the same reference, but 502.
Thank you. Good afternoon, Miss Waterton. Now, please take a seat, make yourself as comfortable as you can be, and you will be asked some questions by Mr. Gale.
Thank you.
Thanks. When you're ready, Mr. Gale.
Thank you, my lord. Hello, Mrs. Waterton.
Good afternoon.
Your full name, please?
Is Margaret Waterton.
Good. Yeah. Now, your details, including your contact address and your age, are known to the inquiry, and you've provided the inquiry with two statements, which I've given the numbers for, because you've tragically lost two loved ones to COVID-19 6 months apart.
That's correct.
The first was your mother, Margaret Simpson, and she died in University Hospital Monklands, I think.
That's correct.
And she died on the 18th of June 2020.
She did.
And then, just over 6 months later, your husband, David Jack Waterton, and he died on the 2nd of January 2021.
He did.
In the University Hospital Hermias.
That's correct.
Now, as I'm sure has been pointed out to you, Mrs. Waterton, there is, in respect of naming other people, what we call a general restriction order. That has been disapplied in your case in relation to your mother and your mother's name and your husband. But I'm sure you'll probably just refer to them as your mother and your husband.
Yes, that's my intent.
But can you remember not to mention any other names?
I will.
And in particular, there is some evidence in your statement about conversations you've had with medical professionals.
Indeed. And
again, can you just refer to the person as either the doctor or the nurse or the consultant? Also, I think, Mrs. Waterton, that you're agreeable that the statements that you've given, together with the oral evidence you're going to give today, will form your evidence to the inquiry, and also that your evidence will be recorded and published.
That's correct.
And before I go any further, I think it is important to note, so as to give your evidence some context, that you are a medical professional, or were.
I am retired and no longer on the NMC register,
Right.
but my last post was Director of Nursing in a mainland health board in Scotland.
Yeah. And how long did you do that for?
I worked in the NHS for 39 years,
Right.
all told.
And how long were you a Director of Nursing?
By the time I retired, somewhere around six or so years.
Okay. Thank you. Can we begin, please, by learning a little bit about your mother? I think she was 86 when she died.
She was 86, yes.
And she died of nosocomial COVID.
She did, yeah.
Yeah. Can you tell us just a little bit about her, please? I know it's difficult to confine 86 years into a few sentences, but just a little flavour of her.
So Mum was never more than 5 foot at best, but by the time she became 86, she was 4'10". But she packed a weighty punch, not literally, but she was feisty and could be a little shy at times, but she was much loved, and much loved Mum and Gran, sister, aunt and friend. She very much loved her 3 grandsons. She's not been able to welcome her first great-grandson into the family, but that would have been an absolute delight for her. In her younger years, she used to like Scottish country dancing and so on, which was remarkable, really, given that she had lifelong brittle asthma. But that was one of her favourite things to do. She was a great baker, made great shortbread, and many of my work colleagues enjoyed a box of shortbread when I'd been home for holiday.
I think she was also a keen gardener.
She loved her garden. I did not inherit her green fingers, and that was a disappointment to her, I'm sure. But she loved her garden, and her neighbours always used to stop and ask her for advice because her garden was always beautiful.
Yeah. Now, I think she also did have, pre-pandemic, a number of health issues. As you've indicated, she was a lifelong asthmatic.
Yes, she had developed, as with any individual who has a chronic respiratory condition, as you get older, you develop other respiratory issues. So she had, by the time she was in, at this point, severe COPD, emphysema. And she'd also Meniere's disease, which is a sort of vertigo kind of issue.
Mm-hmm. Yeah. And I think you also indicated she had osteoarthritis.
She did. That was a real problem for her. As a young girl, she had fractured her shaft of femur, and in those days that involved being strung up in traction for a lot of months. And she had differing leg lengths, and that played a part in some of her arthritis issues. And it was she found standing for any length of time, so particularly cooking for herself, she found that quite difficult, but she always tried to go out every day to walk. She enjoyed going to a lunch club once a week, and the distance she could walk was shorter, but she did enjoy, and she made sure that she did because she believed that was important for both her physical and her mental health.
Yeah. We'll come very sadly to talk about your husband in a little while, but I think you and your husband got married in, was it 2011?
We did.
And I think your mother enjoyed being mother of the bride at that stage.
She very much loved that, and when we were choosing her mother of the bride outfit, to use a good old phrase, I was roaring and greeting in the shop when she came out. She just looked so elegant, and my mum was delighted with that. And on our wedding day, when she came into the room and saw me in my bridal gown, I think we both gasped in delight and very much enjoyed that mother and daughter moment.
Okay. Importantly, you've said she was feisty. She had complete intellectual capacity.
Yes, in my statement I've described her as sharp as a tack. You got nothing past her, and she really was very, very in the moment and on the ball.
I think you had a power of attorney in relation to her, is that right?
We'd set that up when she had her will prepared. We also set up power of attorney because we thought that was a very sensible move.
Now, I think just to look at the perhaps slightly wider family situation at the time, and this is obviously in the pre-pandemic days, your husband, that we'll come to talk about in due course, he had chronic fatigue syndrome, I understand.
Yeah, he'd been had lots of investigations and hospital admissions looking at complex sleep apnea. But just in the latter end of 2019, he'd been given a diagnosis of chronic fatigue syndrome. The symptoms fit. My husband was a very, very fit man. When we met, he was a hill walker. Used to do a Monroe every other weekend. A fit chap, football, golfing, that kind of activity. So the diagnosis at the back end of 2019 was somewhat startling for both of us.
And I think you have a brother, and please don't name him because of the restriction order. Do you have a brother who also has severe COPD?
Yes, my brother is a couple of years younger than I am, and he was diagnosed with severe COPD some years ago. We've no idea why he's got COPD, because he's certainly never been a smoker, but that's the situation he's in.
And against that background, can you just tell us what your approach to life generally was when we started to hear about what was happening in China and then in Italy and Spain in early 2020?
Both my mum and my husband and I were watching everything that we could see on the news, and frankly wondering when the government was when we were going to go into lockdown in this country. My mum was very worried about what she was seeing and hearing on the news, because she knew that she had a chronic respiratory condition and that this was a highly contagious respiratory disease. And she was very worried about herself. In fact, she said that if I get that COVID, I'll be a goner. And her words and deeds were prophetic. So probably about 2 weeks before the national lockdown, I spoke to Mum, and we decided together that she would really stay at home. And that was about 2 weeks before the national lockdown. And I would do all the shopping and so on and so forth. She would stop going to the lunch club so that she wasn't in contact with groups of people.
So would it be right to say that generally you as a family, wider family unit, were being very careful in those early days?
We were being very careful. I was terrified for my mum, and I was equally terrified for my brother. And my mum was terrified for him as well as for herself. I was worried about my husband because we didn't know enough about COVID to understand whether his issues and the diagnosis of chronic fatigue syndrome would have any bearing there. So we were, as a family, we really wanted to protect my mum.
Obviously, we know we just be clear, at the beginning of 2020, your mum, as I understand it, was living independently.
Yes, my father died in 1999, so Mum had lived on her own and independently all of that time. And at 2020, Mum was doing some of her own shopping. She couldn't carry heavy bags. We did that for her. But she would pay her own bills. She would go to her lunch club, and she used the daily journey to the shop. That was her walk and her social connection, as she saw people when she was going about. So she was very independent. We'd organised a cleaner for her, but other than that, she lived very independently.
Yeah. Now, obviously, we know in March 2020 came lockdown.
Yes.
And what was your mum's reaction? You do tell us about this in paragraph 20 of your statement. It'll come up on the screen in front of you. What was your mum's reaction to lockdown?
She was anxious about it because as part of our wider family, my mum's sister, my aunt, used to be a very, very regular visitor. My aunt was 3 years younger than my mum, still driving, and she was a very regular visitor. So, and Mum used to pop in and out to her neighbours for coffee and so on. So all of that stopped, and she was anxious about it, and it took me a wee while to get her to understand that I was a risk to her by coming into the house potentially, because I was going out and about doing shopping and so on. But she was very stoic about it, and she used to go out every day for a walk round the block. But over time, she became more and more feeling isolated, withdrawn, not her usual social contacts. My mum had macular degeneration, so using technology to do video calls or whatever was not an option for her. So she was reliant on contact. So it began to get her down, and she told one of my other aunts that it was an existence, not a life.
Yes, you say that at the bottom of paragraph 20. Yeah. Your mother, from the medical history you've given us, would obviously be regarded as a vulnerable person, and I think she did receive a shielding letter, is that right?
Yes, she did receive the shielding letter, and as did my brother, in fact. And we put arrangements in place to make sure that Mum could have her shopping, could have her medicines delivered, and so on. And we were very clear at that point that nobody was going to be across her threshold. Yeah. It was too much of a risk, too much of a risk.
Now, I think in late May 2020, you received a call from your mother who told you that she wasn't feeling well. And as you tell us in paragraph 23, she seemed quite confused.
Yeah,
Can you just explain that a little?
Sorry, she did call me, and the conversation was quite garbled. So I understood that she obviously wasn't well, and repeat chest infections were a pattern for Mum over time, because of her respiratory conditions, normally dealt with at home with antibiotics and steroids. And however, over time, as Mum got older, they were more frequent and they were more severe. And so I went straight in to see her, and it was very obvious. She was very flushed. It was obvious that she'd got a temperature. She was a bit confused and clearly unwell. Yeah,
and I think this was probably the first time that you'd been into her house for a number of weeks.
Yes, nobody had been across Mum's threshold, including myself. If I dropped shopping off, I made Mum stand 2 metres back from her front door while I put the bags of shopping inside for her. And if I went across to have a coffee, I sat outside with the wind howling round the corner, and sat outside and had a coffee. I think I had my winter coat on probably till this point, so that nobody was across her threshold. That was the first time I'd been in Mum's house since mid-March.
Yeah, and I think you equipped yourself with some PPE, and we know that you were an experienced nurse, so you would know perhaps what to get and what to wear in that situation.
I'd accessed online disposable face masks, and after a lot of searching, because they were like gold dust at the time, I'd managed to access disposable gloves. Right. Disposable aprons were even more like gold dust, and I didn't have any of those, but masking gloves and hand gel.
Right. Having found your mother in this condition, what did you do?
I contacted the local health centre and asked if a GP could come and visit Mum. I was asked actually if I could get her down to the health centre, which was going to be impossible because actually she couldn't take 1 or 2 steps. So the GP did come, and he was wearing mask, scrubs, scrub outfit, disposable mask, gloves and disposable apron. And he came in and examined Mum. He indicated then that she had a significant chest infection, actually began to think that she was on the verge of sepsis and that she was in a state of delirium. And I asked him at that time, he said he thought he was probably going to have to admit her to hospital. And I asked at that time if I could access a commode from the joint equipment stores, as they're known. But he told me that they'd been completely closed down because of lockdown and the restrictions. So something simple that would have enabled me to keep an older, vulnerable person at home, I wasn't able to access, and she had to be admitted to hospital.
And I think you also made some inquiries about access to the district nursing team.
I did.
What was the reaction to that?
I asked the GP if it was possible for Mum to have, because he indicated she would have to have intravenous antibiotics. So my skills are far too rusty. That was not going to be something I was going to be able to do. Although if they had put the cannula, inserted the cannula, I would have had a good go at giving the drugs, but I wouldn't have been allowed to because I'm off the register. And he indicated to me that that was not going to be possible. And now we're talking about hospital at home, where that kind of thing is possible. But if that had been available to us, Mum wouldn't have needed to have gone into hospital.
And if those arrangements could have been put in place for you, would your mum have remained in her own home, or would have come to live with you? What was your views on that?
I was going to keep Mum in her own home, and I would have moved in with her.
Okay, right. Now, you've mentioned admission to hospital, and I think we know from what you say at paragraphs 31 and following of your statement that she was admitted to the University Hospital Wishaw.
That's correct.
Taken there by 2 paramedics, and she was in the first instance put into the respiratory receiving unit in A&E.
Yes.
You tell us that in paragraph 32.
Yes, that's correct.
And she was tested on admission for COVID, and the result was negative,
Yes, that's correct.
as you say. You then describe what happened thereafter, but if I could just take you to paragraph 35, you make the point there that your mother was in 3 different clinical areas in those, presumably the first day or 2 of her admission into hospital. And you make a comment about that. Could you just explain what your concern would be about that, as bearing in mind your background?
Mum was in hospital for 4 nights and 3 days, and in that time she was in 4 different clinical areas. Pre-pandemic, that would have been considered to have been a breach of patient safety. There's an highly increased risk of cross-infection, moving patients from clinical area to clinical area, so ward to ward. And then if we overlay that with a highly contagious respiratory infection over and above, and all of the stories that we were hearing, no visitors were allowed in hospital, so it was impossible to know about levels of PPE, the appropriateness of what was available and so on. So I can't comment on that directly. But that risk of what's termed as boarding patients out from clinical area to clinical area poses a high risk of infection. And subsequently, if I may just expand a little,
yes, please do.
I've provided my legal team with some very clearly published research that relates to this particular health board, relates to the hospitals within this health board. At the time Mum was a patient therein, and the research is based around boarding of patients and COVID clusters, so outbreaks. And the research paper makes the point that the rate and the frequency of boarding of patients was an absolute contributory factor. There's also for frail elderly people the risk of disorientation, moving from one area to another in that regard.
Yeah. So with your nurse's hat on, was that once you discovered that information, was that a particular concern to you?
It was a concern in my previous life, in my working life. We worked strenuously to make sure that that kind of level of boarding did not happen. And if it did, it resulted in a review of what were the circumstances that led to that. Now, that was pre-pandemic. So one would have thought during the pandemic that boarding would have been, whilst I understand the pressure that the NHS was in, one would have thought that boarding of patients would have been something that wouldn't have happened, because we were being led to believe there were COVID and non-COVID wards.
So just to understand, and from your professional perspective, the exigencies of the pandemic should not, in your view, have excused a situation where there was the possibility, or the high possibility, I suppose, of cross-contamination.
Yes.
Okay. Now, your mother was in hospital for 4 nights and 3 full days, as I understand it. What was your understanding of, put it bluntly, what was wrong with her when she was in hospital?
Chest infection, and they discovered an underactive thyroid and a couple of other things wrong with her blood chemistry. But those are fairly typical things in an older person who had a significant infection and was a bit dehydrated, most likely.
And well, you tell us at paragraph 36 of your statement that, I'm sorry, paragraph 37, that she was discharged from hospital after that period of time.
Yes.
And she was on oral medication. And you say that she was bright and cheerful on her arrival home.
Yes. Her neighbours were out. It was a beautiful sunny day, and her neighbours were out in force to welcome her home. I was there. By that time, I'd acquired PPE from our local carers network. So I was wearing my mask, apron and gloves. And Mum came out in the ambulance and was like the Queen, very delighted to see her neighbours there. She looked well at that point, and she was glad to be home. The thing that I would say about her over the next couple of days is that I thought she was extremely quiet, and I couldn't quite fathom out what that was. And I wondered if it had been about company while she was in a ward with other people. Right.
And I think in that period while she was in hospital, you took the opportunity to clean her house.
Yes, I gave it a good going over.
Good once over. Okay. Now, on her discharge from hospital, you, I think, were looking for her discharge letter.
Yes.
And you found another envelope which had a DNR, we'll sort of shorten it to that, form in it. Can you just tell us about that, please?
Mum knew that her discharge letter was in her bag, and her way was that if something had to be delivered to the GP, it had to be delivered immediately. So to reassure her, we started to look for that, and then I found this other envelope, and when I drew it out, there was a DNR form in that had an attempt at a signature from Mum at the bottom of it. And when I asked Mum what this was, she said that she didn't know what it was and asked me to tell her what it was. So I explained to her that it was a DNR form and that it indicated that she had signed it and that she'd signed it directly on her admission to hospital. Mum then said that she couldn't remember signing that, and she was very shocked. She asked me what it meant, and I explained to her that she had agreed that there would be no attempt at resuscitation if cardiopulmonary resuscitation was required, and she was horrified that she had agreed to that. After she'd had a moment or two to gather her thoughts, she said that she remembered when she'd gone into hospital initially that a doctor, a female doctor, had spoken to her, but she couldn't really understand what the doctor was saying, and she felt that the doctor was putting words in her mouth, and that she had been made to sign the form, but she didn't know what it was that she was doing. Right. And I would just reflect that at that point my mum was in a state of delirium, and that's clear in her hospital notes.
Yeah. And that would be consistent with the confusion that you observed prior to her admission to hospital.
Yes, and her high temperature, yes.
You made a complaint about this, I think, and we see that in paragraph 43, and you got a response, and you refer to this in paragraph 44. Can you just tell us what your complaint was and what the response was?
I called the, I'll narrow it to the complaints team, at the hospital, and said that my mum had come home with this DNR form that she had no recollection of signing. In fact, I just repeated what Mum had said, and that I wanted to make a complaint about that. There was much toing and froing from the complaints team, and it took a long while to get a formal response. However, the response was that the medical director of the hospital, as he was entitled, had said that the junior doctor that had gained the DNR consent should not have done so, given the circumstances that Mum was in, and they apologised for that.
Would you have been able, at that time, to know what your mother's likely response would have been had she been in a position to understand what was happening to the putting of a DNR notice in front of her? Would she have been agreeable to it?
No. Once I'd had the opportunity to talk with Mum about what it meant, she did not agree. And what we did actually agree together, she and I, was that once things were not so difficult in terms of the restrictions that we found ourselves placed under, that my brother, myself and Mum would have a conversation so that we all understood what her wishes would be. But at that moment, at that time, she did not agree.
Yeah. Right. Your mum's been discharged home, and you tell us in paragraph 45 that you started to come to her house as often as was necessary, as you put it, and that in the period that you were coming into her house, you observed distancing.
Yes.
And you also wore the PPE that you had acquired.
Yes, I did.
And you also tell us that nobody else came into her house.
Absolutely not.
And unfortunately, your mum then became increasingly unwell.
Yes.
You just explain how that manifested itself.
Over the first couple of days after Mum got home, she, as I've said, she was very quiet. And while she might not have been the loudest person, she was always more chatty than I was experiencing her at that moment. And I wasn't entirely sure why that was. However, after Mum had died, one of my aunts said that they had a very regular phone call, and Mum had said to my aunt that she thought she had that COVID. So having had COVID now myself, I can understand what Mum would mean, because it was unlike any other kind of illness I've ever had. However, over that intervening few days to the beginning of the following week, she started then to feel as if she was becoming a bit more breathless, and it was obvious that her temperature was spiking up and down. So I called NHS 24, and at that point you were being immediately directed to a COVID hub doctor, and the doctor, from the symptoms that I was describing in Mum's recent hospital admission, thought that it was probably a recurrence of her chest infection. Again, that could have been likely because we had had that experience with Mum in the past. However, what she did suggest to me at that point was that I seek to have a COVID test, both for Mum and for myself at that point. And then she agreed that she would send, it was an advanced nurse practitioner that came to the house that night to listen to Mum's chest.
Can I just ask you, did you obtain a test for yourself and your mum?
No. At that point, there were no mobile testing centres set up at that time. So what you had to do was use the Test and Protect, as it became known, online service to request a test that was delivered to your home. Now, I managed to do that for Mum because she had symptoms, but because I was asymptomatic, I didn't fit the criteria. And I used the helpline to actually speak to a human being to try and make that point known, that I was being advised by the COVID hub doctor to get a test for myself, and was told that I couldn't have one because I didn't have any symptoms.
I think you explained this in paragraph 51 of your statement, and I've slightly skipped over some of the intervening paragraphs, but again, we have those,
Yes.
Mrs. Waterton, and we're certainly not ignoring them. You got a test for your mother.
Yes.
And you submitted that. I think it was, you had to wait for it to arrive by a courier. You had to then send it back by a courier, and you obtained a test. What was the outcome of that?
Well, by the time I got the result of the test that I'd done in Mum's home, Mum was already in hospital.
Yeah.
So I already knew by the time Mum was admitted to hospital, because she was really very unwell. The doctor, another COVID hub doctor, believed that she had COVID. And the day I did the test, Mum was admitted to hospital. So it was another 72 hours, more or less, before I got the result of that particular test that I'd done at home.
I think when you did the test, you noted the condition of the inside of your mother's mouth.
Yes.
Can you just describe that?
As you'll understand, as a nurse, I've seen the inside of a lot of people's mouths over time, and this was unlike anything I'd experienced. Her mouth was just completely coated, and looked really uncomfortable and horrible. I'd not seen anything like that.
Yeah. You tell us, and reading short, that you were advised and the doctor decided that your mother should be readmitted to hospital.
Yes.
And prior to that, or perhaps as that was happening, did you discuss again the DNR situation?
I didn't discuss it on that day with Mum.
No. Okay. Right.
Although, Mr. Gill, sorry,
Yeah.
just as I recollect, Mum, just before these few days, but after she'd come out of hospital the first time, did say to me, well, I suppose if I get that COVID, in my age, they're probably not going to do anything for me, is what she said.
Okay. Right. Right. She was admitted, I think, to the University Hospital Monklands.
That's
you
correct.
tell us that in paragraph 57.
Yes, that's correct.
And that was the 7th of June 2020.
That's correct, yes.
And she was admitted to a COVID ward.
Yes.
Had a COVID test on admission. And the ward staff nurse, or assume it's a ward staff nurse, phoned you on the 8th, the day after she was admitted,
Yes.
to tell you that she had tested positive for COVID.
Yes.
It's probably fairly obvious, and what your reaction would have been to that, but can you tell us what it was?
I broke down on the phone, and I was so frightened for my mum. I didn't know what the outcome would be. The nurse tried to reassure me and said that they had, this mum was admitted to a ward that was in a bit of the hospital that had been made into a COVID ward. It hadn't existed before that. And the nurse said to me that she had seen people that were mum's age and older surviving and going home, and that I was to try and keep positive about it.
Now, you do tell us what you were subsequently told in a conversation with the consultant.
Yes.
You tell us that in paragraphs 60 and 61.
Yes.
Now, I don't want to ask you to do anything that you're unhappy about or uncomfortable with. So if you want us just to take what is in 60 and 61 as read, we can do that. But if you feel up to it, can you tell us what you were told?
Yes, the day after Mum was admitted, and I'd been phoned in the afternoon to say that she had tested positive for COVID. The consultant phoned me the following morning. I was Mum's next of kin. She was very measured, very kind, very compassionate, and said to me that given Mum's age, her general frailty, her severe respiratory condition, that she did not think my mum, if it came to it, would be able to withstand either CPAP or high dependency level or, in fact, intensive care level treatment, that she wouldn't be a candidate for intubation and ventilation because she wouldn't be able to withstand it. No. And that they would make every effort to care for Mum and offer her full treatment up until it became necessary for her to have, if CPAP was going to be required, then they wouldn't be able to go forward with that. Mm-hmm. And I agreed with Mum, with the consultant about that, that Mum wouldn't be able to withstand that. And in fact, it would have been cruel to have put her through that.
Yeah. Did you have any direct contact with your mum when she was in hospital at this time?
No visiting was allowed, and Mum had a mobile phone. She would text on it, but she wouldn't make or take calls on her phone. Mm-hmm. But given that she was on high flow oxygen through a face mask and she wore glasses, she had macular degeneration. It all became very difficult. So she did try and text, but that stopped. It became a bit muddled because she couldn't see. And she did try to make a phone call one night there was a phone in the ward somehow, but she couldn't hear sufficiently and it distressed her, so we didn't do that. In that first week that Mum was in, I think within 2 or 3 days, one of the nurses used her own phone to make a WhatsApp call with me. And I so appreciated that. That was so kind.
Over a period of days, I think it became apparent that your mum's condition was deteriorating.
Yes.
And I think you had regular calls with the doctor on the ward. Is that right?
Daily conversations.
Yeah. And as you tell us in paragraph 68, you received a call on the 15th of June, so
yes.
Just over a week after your mum had been admitted. And this was from the ward's specialist nurse. And she asked you if you were planning to come and visit your mum that day.
Yeah.
Did that send a signal to you?
Initially, I was so taken aback, and I felt a bit angry because I thought if I could have been in visiting Mum and I hadn't been, so I was a bit angry. And then I thought, well, I could see Mum, so that was really joyful. And then I thought, this doesn't bode well.
And I think your reaction that it didn't bode well was borne out.
Yes.
And what were you told?
We went to the hospital, so all of us, my husband, my brother and sister-in-law, all of us went to the hospital in 2 separate cars because we weren't allowed to be together. My brother he was in the shielding category. And I was told that I could come into the ward for a very short time to see Mum, so I was already wearing a face mask, but given an apron to wear, disposable apron, and I was allowed in to see Mum for about 15 minutes, and then I was taken to speak with the doctor, one of the junior doctors, and taken to a room on my own, and I knew then that bad news was about to be broken, and the doctor told me that they'd done everything they could for Mum. Despite everything, her oxygen levels were falling all the time, nothing was working, and we'd reached that point where they didn't think she was going to survive.
Yeah. So far as continuing to see your mum in hospital after being told that, what were the arrangements or the instructions in relation to that?
That day,
Yeah.
I was allowed to go back in to see Mum. I was then, at that point, the nurses very diligently dressed me in full PPE. So theatre hat, full-length gown, double gloves, FFP3 mask, visor, and Mum was in an infectious diseases ward by that time, and so there was an ante-room to the actual patient room, and I wasn't allowed to come out of Mum's room without using the call bell, so that two nurses would come out into the ward corridor and they had flashcards. So once they were there, I could come out into the ante-room and they would instruct me how to take the PPE off in the correct manner so that I didn't contaminate myself in any way. And that first day after the doctor broke the bad news, I was allowed to go back in then and see Mum for an hour, and then was asked to go, and was advised then that I could come back in for another hour the following day, and that would be how it would continue. But that changed so that as long as I could tolerate the PPE, I could stay in the room with Mum. But to try and avoid the mornings, because obviously the nurses were having to dress me in the PPE, and that's what I did. And on the day she died, I was there with her.
I think you tell us in paragraph 71 that you were able to spend around 3 to 4 hours
Yes.
with your mum each day
Yes.
in the last 2 days of her life.
Yes, and that was, you know, never thought I would say I was lucky for being able to do that, because we've previously taken that as something that we should all be able to
always
do.
be able to do.
But I was lucky.
Yeah. You make some comments about PPE in paragraph 72 and following of your statement, and I think it's perhaps important, given your background, if you just tell us a little bit about, well, first of all, you saw no shortage of PPE in the ward.
I wasn't aware of any shortage, and my view is that I was enabled to visit and stay with Mum because there was no shortage of PPE.
Yeah.
And I didn't see any, I wasn't made aware of any issues around it at that time on that ward.
Yeah. But you did witness a number of breaches of infection control practice, you tell us. Can you just tell us a little about those?
On the day that Mum died, I was sitting in full PPE with Mum, and bearing in mind that I've just said that I wasn't allowed to leave Mum's bedside and go out into the ante-room unless there were one or two nurses out in the corridor watching me remove the PPE. And when the staff came in very briefly to Mum, they would have a mask, disposable apron and gloves on just for a very brief interaction in the room. But whilst I was sitting there, a member of the domestic staff, the cleaning staff, there was a knock at the door, and she just came in and she was doing a nice thing. She was bringing a card in that had been delivered for Mum, but she didn't have any of the appropriate, she didn't have an apron on or anything in that room on that day. And I'd seen a consultant, I recognised as a consultant from what I could hear going on in the ward round, but coming into the ward without wearing a face mask, which was required on the ward. And on one occasion when I had left Mum's room, the nurses had moved off and I wanted to speak to them. So wearing only a mask, I had made my way up to the nurses' station, and I got a fulsome row for having moved in that ward corridor without permission, and yet the consultant was walking up and down with no mask. On another day, I saw, I think I say that later, what I recognised to be a patient safety walk round happening. And my husband and I were again waiting to see the doctor, and we were sitting out in the main corridor. The doors to the outside of the hospital were open. It was a sunny day, And these members of staff started gathering, and it dawned on me that it was a patient safety walk round. And in that moment, I saw the individual who was leading the walk round have to be instructed about how to wear a disposable face mask correctly. And she had it on upside down and the wrong way round initially, until actually the estates manager, who I had seen his name badge, pointed out to her that she was wearing the mask incorrectly. And when I later went into the ward with doctor to have a conversation and then to go and see mum and be put into my PPE, the people from the walk round were milling around in the ward. And I suppose I was taken aback that these things were still continuing during the pandemic, and the risk of infection about individuals moving in and out of what was fundamentally a ward where there was COVID infection.
Yeah. So your reaction to that, with your professional background, was one of what?
I was shocked, actually, because the footfall through the ward in that event, when I was having to, be so careful. Everybody was being so careful. But that footfall through the ward, I found, was extraordinary, and was, to me, an absolute breach in infection control practice waiting to happen.
You also tell us at paragraph 74 that you witnessed breaches of infection control practice within ambulance staff. Was that in connection with your mother being taken to hospital, or was that just you observing when you were at the hospital?
That was observation when we were at the hospital, watching on the first day that I got in to see mum and the bad news had been broken. Understandably, we were reeling, and my husband and I actually walked round to the main entrance of the hospital, and he himself actually said to me that I'd be shocked at what I would see. And ambulances were pulling up to the door, patients were being taken out of the ambulance. One member of ambulance staff, a two-person crew, one would have apron, gloves, mask, and the other would maybe have a mask on. And the ambulances didn't look like they were being cleaned down in between patients. They were being pulled in and out.
Okay. You also mentioned viewing a YouTube video of the nurse director of NHS Lanarkshire, and you tell us in paragraph 76 what the import of that particular video was. And I think you make a connection with the day you think that your mother contracted nosocomial COVID.
Yes. After this period, I came across this video on YouTube, and the nurse director from NHS Lanarkshire, as I've described, was Gold Commander on that particular day, and urging staff across NHS Lanarkshire to avoid meeting in communal spaces in the hospitals, as they were concerned about staff outbreaks. And I relate that to my earlier description of the research paper, because again in that paper, the researcher, who happens to be a consultant microbiologist in this particular health board, said that staff were not wearing PPE correctly and appropriately in various areas, but particularly in areas that would have been as staff areas previously prior to the pandemic. And my sense was one of anger, because that was likely around the time my mum contracted COVID.
Right, we go on to the 15th of June. I think you tell us that it was considered that it was too much of a risk for your brother to come into the ward.
Yes.
And he had to look through the window. And I think you say that your mother really couldn't see him, nor could she hear him.
She couldn't. I explained to her that my brother was looking in through the window, So she raised her hand and waved, and I explained that he was waving back, that my sister-in-law was also at the window. But until every day when I was in visiting Mum from then till she died, she would ask when he was coming to see her.
Yeah.
And I explained that he couldn't, but it was what she wanted.
Yeah. You were subsequently told on the next day that, by the consultant, that they would try your mum with oral dexamethasone.
Yes. Yeah.
And I think you described that, and perhaps you can use the expression you tell us about how that was described to you.
The consultant said at that particular time, dexamethasone was used as a trial drug in the treatment of COVID-19, and the consultant said that she would try that with Mum to give her that orally, and she used the expression "one last throw of the dice."
Yeah. And if that didn't work, as you tell us, then they would move to, I think we know, end-of-life medication.
Yes.
And you agreed if there was no change with the dexamethasone, then all you wanted for your mother was, as you put it, dignity, comfort and grace.
Yes.
And peace, peace. Yeah. Can you tell us, if you're able, what happened thereafter?
So the dexamethasone hadn't made any difference, and at that point, Mum was receiving high flow oxygen through a face mask, so her mouth was incredibly dry because of that, and it was just simply purgatory for her, and it was just terrible to sit and watch that. So that's why I'd said that I just wanted her to have comfort and peace. So the doctor said that they would then move on to the morphine and midazolam. And morphine enables people with deep respiratory conditions to, it eases their breathing. And the midazolam is a sedative medication. Yeah. So when I went back in to see Mum the day before she died, I'd already seen the doctor. The doctor knew I was coming to speak with her. And when I went in to see Mum, she was very quiet and looked at me for a long time, and then said that she told me the doctor had spoken to her that morning and said that she wasn't going to survive. And I just didn't know what to say to her. I said that I knew she was very ill, and then Mum said that I'm not going to survive, and I think I knew, is how she put that to me. And
do you think that that should have been told to your mother in that way and without anybody there?
No. The doctor knew I was coming to the hospital, and my firm view is that that conversation could have been had when I was in the room with my mum. My mum didn't need to hear that when she was there by herself. That for the sake of a couple of hours, then the compassionate thing for me to happen would have been that I was there with Mum, and the news could have been broken to both of us.
I think you were able to spend time with your mum on that day, the 17th of June. You were able to talk to her, hold her hand. Yes. And the following morning you received a call, I suppose one that you were probably expecting.
Yes.
At 7 a.m. And you were told that there'd been a change in your mother's breathing, yes. And that you should come to the hospital. Yes. And you were able to do that? Yes. Yeah.
Yes, my sister-in-law drove us, my husband and I there. He wasn't allowed in, but he came with me, and I have to say she took off like a bank robber to make off, so that we got there in plenty of time.
And you were able to spend time with your mum from around 8 a.m. on that day?
Yes.
Until, as you tell us, she passed away peacefully at about 3:30.
Yeah, it was peaceful, but it wasn't merciful.
Yeah, yeah. And the brutal fact, I suppose, is the cause of death on her death certificate was certified as COVID-19.
Yes.
Now, you do tell us about a number of complaints that you made to NHS Lanarkshire, as it is your belief that your mother contracted COVID while in their care when she was in hospital.
Yes.
So could you just explain what the complaints were and what the responses were?
I used the complaints process to say that my firm belief was that my mum had contracted COVID whilst she was in their care. She had tested negative for COVID during her first admission, and the timeline fit in terms of her development of symptoms of COVID. And again, actually it was in August 2020 when I finally got my response letter from the Health Board. And they confirmed that in the time that mum had been in the care of frail elderly ward, which was the ward she was in very last, there were something like around 4 other patients at least who had tested positive for COVID at that time in what was labelled as a non-COVID care of frail elderly ward. And they set out in their letter that they'd used a public health algorithm. I'm afraid I can't articulate it any differently than that.
I'm pleased you can't.
To calculate the likelihood of where mum had contracted COVID, and it was extremely likely that she'd contracted it whilst in University Hospital in Wishaw.
Wishaw. You didn't get an apology, as you say in paragraph 88, and you say there was no recognition of the fact that she had contracted COVID-19 while in the care of NHS Lanarkshire, and no explanation as to how this had occurred. Do you not feel that the letter that you received was at least in part an acknowledgement of that?
It was in terms of the fact, but the process around that, so they did not relate anything to the boarding of patients, they didn't relate anything to infection control practices, there was no discussion, it was a bald statement of fact, and no real apology as far as I'm concerned that those breaches occurred and that because of those my mother contracted COVID whilst in their care.
If you feel able to, can you read paragraph 91 of your statement?
91. Oh. Mum was 86 years old when she died. She was interested in life and people and took such pride in her family. She was living independently and had done so since the death of my father in 1999. She had a good quality of life, and though she lived in a simple, quiet way, she had life yet to live. She never got to meet her great-grandson, which would have been one of her greatest joys.
You tell us about the funeral, and we know that there were only there could only be 20 people.
Yes.
At the funeral, and you give us the details of the funeral.
Yes.
We can read that, and I don't want to take you through that, but you do reflect on a number of the impacts that this has had on you. Now, some of these impacts, with respect, I will come to when you've given your evidence about your husband. So I'm not ignoring them, but perhaps those that are specific to the circumstances of your mum were that you say at paragraph 96, and this is something we've heard from a number of witnesses, is that there's an element of blaming yourself. Yes. And I suppose an element of guilt. Yes. That you feel. And I think you say that you are concerned that perhaps you could have tried harder to keep your mother at home, and you also reflect on the possibility that had she been afforded something as simple as a commode, that might have enabled her to be kept at home.
Yes. And
the same observation you make in relation to the availability of district nurses.
Yes.
And I think you reflect with the I can't say the benefit, but with the experience of what you subsequently went through, you could identify with the resilience of your mother,
Yes.
having been widowed.
Yes. I always thought I understood about grief, personal grief, bereavement. But I wish my mum was here so that I could tell her how proud I am of her, how strong I believe she was. And that I didn't have a clue about what she was going through after my dad died, really. But how proud I am of her.
Can we pause, my lord, just for a few minutes before we go on to the...
Shall we say 10?
10 minutes, be
5
fine.
minutes, very good. We'll do that. 22 then.
Thank you, my lord.
Mrs. Waterton. Good. Now, when you're ready again, Mr. Gale.
Thank you, my lord. Mrs. Waterton, can we now turn to your statement about your husband,
Yes.
your late husband? You tell us a little bit about him. He was 71 when he died.
Yes.
Again, compressing 71 years into a few sentences, perhaps you can just tell us a little bit about him.
Yep, he was a very smart, very capable man. He was a Rolls-Royce engineer, and that was to trade, and that was something that he was very, very proud of. He, as I've said, there's a dedicated Albion Rovers supporter. It is indeed, my lord. But somebody's got to be.
I was going to ask you where Albion Rovers is.
Coatbridge.
Coatbridge.
Oh, sorry.
I should have told you that.
Thank you.
He also, when David and I first met, he was a very, very keen hill walker. Used to do a Monroe or two every other weekend with a particular walking group. He was a sociable chap, and just talking to somebody yesterday actually from Albion Rovers said he was a character. And he enjoyed golf and football, amateur football when he was younger. And he very much enjoyed when he'd retired. He loved to work with wood and was very skilled in making all sorts of everything.
Right. You do tell us, I'm afraid I haven't got the paragraph noted down, but you do tell us, I think later in your statement, that he was politically astute and active.
Yes.
Did that cause arguments?
No, no arguments. I used to just listen and learn. In fact, he was very politically astute, very active politically in his younger day.
Right. Now, perhaps some of his sporting and other activities took something of a toll on him in relation to osteoarthritis.
Yeah, that had caused some problems in his knees, so he's actually waiting for knee replacement surgery.
Yeah. And as you told us earlier, he was diagnosed with a complex sleep disorder in 2015, sleep apnea,
yes,
as you've told us, and that was subsequently diagnosed as chronic fatigue syndrome.
Yes, yes.
And did he have any other underlying health issues?
He'd had 2 TIAs,
Yes.
and with no recurrence after that. And he was a bit unlucky, I would say, and he also had 2 diverticular bleeds. The second of those was, in fact, in 2019, early 2019, quite a significant bleed, and he was actually due to have knee replacement surgery just thereafter. And so that was postponed, and then we went into lockdown.
Yeah. Can I just be clear, it's a very minor point. Mrs. Waterton, paragraph 11, you say the second episode of diverticular bleed occurred in late February 2020. I think you said 2019. Is it 2020?
Oh, I do beg your pardon.
No,
It's
not at all.
2020. Sorry.
Please,
It is 2020.
It is 2020.
Yes, I beg your pardon.
Not at all. Now, I think also we've discussed, given your family situation, your mother, your brother, that you were very compliant as we approached lockdown.
Yes.
And you tell us about that. With your background, you were very, as you say, very diligent with wearing face masks, hand hygiene, social distancing, and just general matters of hygiene.
Yes, David used to describe me as the COVID police, and fully expected that on occasion I would come back home with a couple of black eyes because I'd been very forthright with individuals about social distancing and wearing masks correctly. He became worse than I was in the latter end.
Okay. Right. Now, your husband wasn't in the shielding category, but I think you decided that given the overall concerns within your family, that you would do, as you put it, all the shopping.
Yes.
And the purpose of that was to what?
It was to make sure that I was minimising risk to David. I was also conscious that I was going in and around my mum, but it was really to make sure that we were trying to be as diligent as we could be and to minimise risk.
Yeah. Now, you did move house, as you tell us, in September 2020.
Yes.
And in December 2020, you had engaged a joiner to do some work in your house.
Yes, it was permitted work, yes.
Yeah. And just tell us what happened as a consequence of that.
Our joiner had been working away in the house for 2 weeks, and then it's coming up to the Christmas period. He had small children, and he had planned a Santa experience weekend in a hotel in Aviemore. And to be honest, he didn't really want to go. And at that time, Scotland was in different tiers, depending on the level of infection, COVID infection. And he didn't live in our area, so he was enabled to travel to Aviemore. He went away, had his weekend, came back, and finished the work in our house. And then he contacted us to say that he had tested positive for COVID, as had his wife, but they were both asymptomatic, and that we should probably get ourselves tested.
Yeah. And I think you also tell us about by being able to pinpoint dates that your husband's 71st birthday was on the 23rd of December.
Yes.
And you had a party on the 19th.
We went out for a meal, as we were permitted to do, with my stepdaughter and son-in-law.
Yep.
And we, again, adhered to all the restrictions. And actually, when we came out of the restaurant and parted company, my husband hugged my stepdaughter. My son-in-law is a police officer, so they were very diligent also about the guidance and restrictions and the rules. And at first she was a bit off-put, and he said to her, "I just wanted to hug my wee girl." And once David had died, she's reflected on that moment long and weary, and was glad that her dad did do that.
Yeah, true. I'm sorry I described it as a party. Please forgive me. I realised that it was out for a meal. But that night, various matters became apparent.
Yes.
And in particular, your husband felt tired. And I think a couple of nights later, you started to develop a cough, which wasn't your normal cough.
No, I have asthma, and
yes.
I knew it was different.
Yeah. And what was your husband's condition at or around that time when you started to develop a cough?
He certainly started to feel quite unwell. He felt as if his temperature was up. He was sweating profusely, but that may not have been so unusual, but he really, and his colour started to drop. He looked pretty grey at that time.
Yeah. And you tell us, although I think you've already indicated, that around this time the joiner had indicated that he and his wife had tested positive for COVID.
Yes.
Your brother, I think, also tested positive. Is that right at this time?
Yeah, my brother and one of my nephews had come to help us with a bit of cleaning up work, and my brother, although we all, during that process, we kept distance, we were wearing face masks, I didn't think my brother looked particularly well. And I got him to come into the house to have a hot drink, sitting in our sunroom with the doors, the windows open, all 2 metres apart, for 20 minutes while he had a drink. a hot drink. And then subsequently, when David and I had our tests, our COVID tests at the test centre, and we got our results the following morning, I made them aware that, I'd previously made them aware that the joiner had tested positive, and I thought they'd best test. And it transpired that probably my sister-in-law had contracted COVID at work. She had a very heavy cold, and her first test was negative, but she tested positive within another 24 or so hours. And my brother, he had COVID at the same time.
Paragraph 23 of your statement, you tell us that you had appreciated that your cough was not your usual asthmatic cough, and that you booked a test for both of you.
Yes.
And your husband asked you to do the test for him. Is that right? And you noticed, that he was very anxious, as you tell us, and also when you did the test, you noticed something that you had seen earlier, a few months previously, with your mother. Yes,
David's, actually my heart sank when I did David's test, and I saw his mouth looked the same as Mum's, and my heart sank at that point. I knew my cough was very different. It was persistent, irritant, and that's not the normal cough that I have with my asthma. And I was very anxious that David had COVID.
Yeah. You got your test results, I think you say, on the 22nd of December.
Yes.
2020, and you had both tested positive.
Yes.
And you were contacted by Test and Protect that day, I think probably on the basis that your brother had tested positive, is that right?
It was, the process then was that if you had a positive test, Test and Protect contacted you to, again, do some contact tracing to work out who your close contacts were, so if they should inform them and so on.
And I think you earlier told us that you didn't receive any contact from Test and Protect in relation to the positive test of the joiner who'd been in your house?
No, we didn't.
Now, you took certain precautions by sleeping on separate floors in your house, I think. But as you tell us, you had no appetite. Everything was effortful, and your husband was worse than you were.
Yes, he was exhausted. He had absolutely no appetite, and of course that wasn't helping because you've got high temperature, so fever. And we were lucky, so we were able to, have separate bedrooms, separate bathrooms, and it was a case of trying to encourage him as well as myself to eat and drink.
You tell us in paragraph 27 and following about the progress of your respective conditions over the Christmas days, and you subsequently, your husband subsequently attended the COVID assessment centre and was given certain advice. This is at paragraph 30.
Yes.
What was his position then?
We'd both had to attend the COVID assessment centre on varying days, and one of the issues around chronic fatigue syndrome is severe headache, so that was a feature David had to manage anyway. But the headaches were really severe whilst he had COVID, and on Boxing Day we had made a call to the NHS 24, so he was asked to go to the COVID assessment centre, and there he got some fairly stern advice about trying to eat and drink more, because that wasn't helping his situation. It was probably making his headaches worse, But he also got some good advice about how to manage his headaches differently with the medication that he had. On those occasions, they arranged transport for us to go. It was a taxi with the partition between the passenger side and the driver's side. The driver didn't help you get in or out the taxi. If you weren't able to do that, you just had to manage somehow. Yeah.
Now, we can read about some of the other symptoms that your husband had, and in particular the severe abdominal pain.
Yes.
And we see that in paragraph 32. But in paragraph 33, you say that your husband had seemed reassured by his visit to the assessment centre.
Yes.
And he was trying to eat and drink. So the exhortations by the people at the assessment centre had made some impact on him.
Yes, I think during that period, we were both frightened. He was frightened for me, I was frightened for him. But that advice seemed to reassure him, and that day that afternoon, evening, he was the most settled I'd seen him.
Mm-hmm. Unfortunately, that didn't continue because you started to hear him coughing, and you describe it as persistent and unrelenting.
Yes, I could hear him. I was in bedroom upstairs, and I became aware of the coughing. And I remember coming down the stairs and actually sitting on the stairs for a moment or two, and it just was unrelenting, persistent coughing.
And what did you think when you heard that?
I thought, this has got to be COVID pneumonia.
Right.
And my heart sank.
Yeah. And one of the manifestations of that was that he was struggling to catch his breath.
Yes, absolutely.
And he couldn't speak to you?
No, he was really, really short of breath. He was terrified. Yeah.
So what did you do after that?
I called NHS 24 and explained the situation, and they said that they would organise for an ambulance to come. But if David's condition deteriorated, I was to not hesitate and call 999. And both those things happened. He absolutely couldn't get a breath, and I called 999, and an ambulance duly arrived. Mm-hmm.
And I think when the ambulance did arrive, your husband was experiencing a very high temperature spike.
Yes, it was almost 40 degrees, I think, at one point.
Yes, and I think the ambulance staff the paramedics made some fairly, I suppose, practical steps to try and lower his temperature, because bearing in mind it was December.
Yes.
They stripped him down to his T-shirt and shorts.
Yes, to take him out, and that was a really really dramatic approach to let's try and get your temperature down. They were obviously concerned. I don't know what his oxygen saturations levels were at that point, but they basically couldn't get him out quick enough and into the ambulance.
Right. Now, bearing in mind you had previously tested positive for COVID, the 29th of December would have been the expiration of your period of self-isolation.
Yes, it would have been.
But the paramedics told you that you would need to isolate for a further 10 days.
Yes.
Any idea why they wanted that?
I asked them why that was, and they just said that was what I needed to do, but they couldn't give me any further explanation of why that would be.
Do you have any view as to why it might have been?
I think, as I later describe, the doctor in Hairmyres, when I asked him about that, said people were just given advice off the cuff with no evidence or sense of information behind that. I think it was just something they were saying.
Okay. Your husband was admitted to Hairmyres Hospital.
Yes.
As you tell us in paragraph 38. And he was admitted to the high dependency unit.
Yes.
Initially, you tell us that in conversation with the doctor there on the 29th, the information you were being given was relatively positive.
Yes. David was initially admitted to a high dependency unit and then out into ward, but back again within a few hours. But the tone of the conversation I had with the doctor, as I've said, was relatively positive. He was on high flow oxygen and he seemed to be responding to that. And in that conversation, I remember saying to the doctor that I wanted to make it really very clear that I wanted David to be afforded every effort and every level of treatment made available to him.
So that presumably was to avoid any dubiety about DNR.
Yes, I was really very anxious about all of that because of my experience with my mum. Subsequently, not at this point, but subsequently in other areas, we've heard about population triage, and I was anxious about the decision-making that was going on. Generally, at this point, given we were hearing not enough ventilators, hospitals running out of oxygen, no beds, I was very anxious about all of that.
Just for at least my benefit, you explain what population triage is.
Well, I've heard that in evidence given by Jeremy Hunt at the UK inquiry when he talked about it as part of a element of, I think it's exercise or Operation Nimbus.
Yes.
And when he was Health Secretary, and that was where he was to be, as Health Secretary, Secretary of State for Health, be given the power to decide fundamentally what ventilators remained switched on, and he declined that. So I've heard about that since, but at this point, in this moment, I was anxious about my husband's age and all of the things we were hearing in the media about lack of ventilators, poor supply of oxygen in hospitals because people were running out.
We know from your statement that in the following days, your husband was not maintaining his oxygen levels, and he was put on CPAP and put into a prone position, as I understand it. Do you know what else he was being treated with or for?
I understood that he was receiving antibiotics and that also he was having dexamethasone.
Was your, probably obvious that he wasn't, but was your husband able to communicate with you in any way during this period?
I'd made sure that David had his mobile phone and his tablet when he went into hospital, into Hare Myers that night. And initially he was making some calls, telephone calls to me and his daughter and other very close friends or family members. And then it was messages, but they became a bit garbled. And ultimately, when he's in the prone position in CPAP, you're not able to do any of those things.
No. Now, your communications were with the nursing staff, as I understand it.
I had daily conversations with the same doctor.
Yes.
And around that, then it would be contacting the ward that David was in to see how things were going, and that would be with the nursing staff.
Yeah. And I think your husband was able to send you some text messages in relation to the attendance of the nurses, and I think he was fairly blunt in what he said about them.
He was.
Yes.
Am I able to say the word that
I don't think that's a problem if you're able to say it. Yes.
He didn't beat about the bush. Generally, was his way.
Yes.
And in a text message, he said, because I was talking to him about the nurses were giving me a positive feel for what was going on, but he said that he didn't know how they would know that because they were never near him and they were shit. Do you think, given your husband's condition at that time, that
was probably accurate, at least from his perspective?
From his perspective, I think that was probably the case.
Now, you were subsequently advised that your husband's chest x-rays had shown that he did have COVID pneumonia and that there was damage to his lungs.
Yes.
And you then continued to have conversations with, I don't know whether it's a consultant or a doctor, and please don't name him or her, but you say that the tone of the conversations you had changed. Could you explain that, please?
Initially, it was the same doctor that I was having a daily, sometimes twice daily conversation with. And initially, as I've said, I expressed more than once that I wanted David to be afforded every effort, every treatment, and that included intensive care, ventilation, and in no way did we discuss DNR. But on the day that I describe, I became aware that the doctor's tone had changed. That's how it felt to me. And that he started to press me then for how far David could walk. And when I said, well, he's waiting for knee replacement, he's got severe arthritis in both knees, so that limits the distance that he can walk because it's painful. Mm-hmm. He kept pressing me, and I was anxious about giving him an answer because I really felt that that was somehow or another going to be really salient in his decision-making. And I couldn't understand that because how far somebody can walk in and of itself is not a decision, not where DNR should be decided upon. So in the end, I said to him that, well, he can fundamentally, he can walk for about half a mile and then he has to stop because his knees are sore. And his response to that is, well, that's what I mean. But I couldn't get him to explain to me what he meant by that. Right.
What did you infer from this conversation?
I became really concerned then that the medical staff were then going to make decisions about David and the level of care that they were prepared to offer him and DNR on the basis of how far he could walk. And I was really anxious about that.
Did you make clear your position regarding DNR in respect of your husband at that time?
I believe I was very clear. I was explicitly clear that I wanted every level of treatment, every care afforded to him, and that for me included intense ventilation and intensive care.
Yeah. So far as you were able to, I suppose, surmise, because you weren't seeing your husband at this time. No. Do you know if your husband had any discussions regarding this?
I don't know that. David didn't discuss that with me in that moment, in those days. But from conversations that I'd had with David previously, and he had full capacity, I can't believe that he would have agreed to DNR.
Right. Well, turn of the year, your husband contacted you, as you say at paragraph 54, by text to say there'd been no improvement and that they were keeping him on a CPAP. And again, he replied to you, and I'll read this rather than have you read it. He replied to you that he was mentally strong, but his body wasn't, and he didn't know if his body could fight it. He didn't mention DNR.
No, he did not.
Yeah. And you subsequently called the ward and were told that it had been decided that your husband would be reviewed by the ITU consultant with a view to ventilation and ITU care.
Yes, yes.
And that presumably was what you wanted.
Yes, although I was anxious for David, I was frightened for him about that. That's what I wanted, and I felt they were reviewing him because that was where what was going to happen next.
Yeah. And what did happen?
I waited all of that day to have some contact from the ward about the decision of the review. I kept calling the ward, and I was told all of the time that the review was still to happen. It was still to happen. And I was getting more and more concerned about that, but I understood that the hospital was busy, the ITU consultants were particularly busy. And then when I eventually managed to get through to the ward around about midnight or so, I was told by a nurse that the ITU consultant had been, that the review had taken place, that David was not a candidate for ventilation or intensive care, and he was DNR. And they said that he'd received the maximum treatment, no resuscitation, and the nurse continued to say that that had been fully discussed with me.
Right. And was that true?
No, I told the nurse that she was a liar, and that I would go to my grave calling her a liar, that it absolutely had not been discussed with me, that I was still waiting for that communication, and that I wanted to speak with the doctor as soon as possible. I called the ward back in the early hours of the morning, and it was the same nurse that I spoke to. And she told me that she apologised and said that there had been a mix-up in communication. I kept asking about David's condition and was told it was the same. There was no deterioration, no worse. And again, I asked to speak with the doctor that I'd been having regular conversation with when he came on duty in the morning.
Now, notwithstanding his condition, I'm assuming that your husband, even at this stage, still had full capacity.
As far as I understand,
yeah.
Yes.
Would he, in your view, have agreed to DNR?
No.
Had you been, well, do you feel that in the situation that your husband was in, you should have been consulted about DNR?
Absolutely. My belief is that the inquiry is heard previously about DNR and how it's been handled, and that a leaflet might be helpful. Well, the clinicians, the doctors, they have guidance in abundance from Royal Colleges, from the GMC, from the Resuscitation Council, from their own health boards. So a leaflet isn't going to do it. This is about full, frank communication, and particularly in this circumstance, if David wasn't able to have that conversation for himself, then they should have been in contact with me and discussed it in full with me as David's wife. And we could have come together to a decision based on the facts of what was going on around David. But I was left not knowing what had been discussed with him, not knowing what he had understood, not knowing what he had agreed to. And for the mix-up happened because the ITU consultant thought that it was better for the ward doctor, who had built up a relationship with me, to tell me the decision. I appreciate it can be a medical decision. But in the end, nobody did tell me. And I ended up in the early hours of the morning having a rip-roaring row with a nurse because somebody somewhere had noted down that that decision had been discussed with me, and it had not.
Putting your nursing professional hat on, is this, do you think, given the circumstances your husband was in, is this a decision that should have been left to, put it this way, the discretion of the treating clinician?
That is how that decision can be made.
Yes.
But my expectation, especially when I was not able to I wasn't able to visit with David, I wasn't able to be with him, And I was relying on them to have those full conversations with me factually about what was going on with David. And if I had been given to understand his medical condition fully at that time,
Yes.
then in the same way that I agreed with the consultant about my
relation to
mum,
mother,
I may
yes.
have reached the same choice.
Yes.
But I'm left believing that other things were at play, and I feel blame and guilt around all of that I didn't fight harder for him.
I suppose this is a degree of speculation, Mrs. Waterton, but you say that other things were at play. What do you think those other things were?
So I relate that back to that view about population triage and subsequent, what we knew at the time, that hospitals were struggling for beds, staff, ventilators, oxygen supply. And David was 71. He was a young man. He was fit. He had full capacity. He had no pre-existing comorbidities as far as COVID-19 was concerned then or is concerned now. And I understand about COVID pneumonia and the damage it can do to lungs, respiratory capacity and function. I think that question the doctor asked me about how far David could walk. So my question for the inquiry, and one of the things that the inquiry should be looking at, is the decision making around DNR that was set up at government level, how that was populated, produced, taken down to health board and individual clinician level, and how that was applied.
Well, we certainly hear that.
Thank you.
Mrs.
Sorry,
Waterton.
my lord.
Not at all. No. That was meant as a thank you, Mrs. Waterton. We perhaps didn't express it too well, but it was.
Of course.
Thank you.
Thank you.
I take you on to the subsequent day. I know this is a very difficult day for you. You tell us about your husband's passing in paragraphs 58 and following, and unless you want to say anything about it, I don't intend to ask you to relive it, save for 2 points. You did receive, as you say in paragraph 59, an apology from the consultant.
Yes.
And what was that apology for?
He apologised for the mix-up in communication because the ITU consultant thought that he was going to call me. The doctor I was speaking to thought the ITU consultant was going to do that and have the conversation. And I understood that, and he apologised for my husband had died, and he was offering me his condolences around that. My stepdaughter had a different view of that because of the repeated apology, and I have tried to just reassure her that was the doctor offering his condolences.
Right. Now, you were able to be with your husband.
Yes.
And you tell us about the circumstances of that. And again, we can read that, and I don't want to ask you to upset yourself by going through that, but you were with him for a time before he died.
Yes, we were there for about 30, 40 minutes before he died.
Yeah. And you do tell us about the events after his death, and paragraph 65 and following. And again, these are matters that we can read about. But again, you do come back to the point at paragraph 76 of your statement about the alarm bells that rang.
Yes.
And we've discussed that.
Yes.
Is there anything further you want to mention about that?
No, I believe that I've said what I want to say about that.
Right. The cause of your husband's death was recorded as COVID pneumonia
Yes.
on his death certificate. You've, as you say in paragraph 78, you haven't explored the DNR decision-making through the NHS formal complaints process, as you didn't have and don't have the courage to do so.
No, I find that
A step
that
too
was
far.
just too much, a step too far.
Yes. Okay.
I'm frightened to read the records myself.
Yes. Yeah. But your solicitors, Emma Anwar and company, have referred you to another firm of solicitors if you want to take the matter
Yes.
any further.
Yes.
Again, if you're able to do so, Mrs. Waterton, can you read paragraphs 80 and 81 to the inquiry?
David was an intelligent man and his capacity was intact. His quality of life before he contracted COVID-19 was good and he had much life yet to live. He was looking forward to making changes to our new house, settling into our new neighbourhood and getting back to travelling again. In a period of 6 months, I lost my mum from nosocomial COVID-19 and became a widow, again as a result of COVID-19.
Now, I appreciate again it's upsetting, Mrs. Waterton, but you talk about reproaching yourself in paragraph 82.
Yes.
And in a way looking at the same, not exactly the same issues, but you experienced it with your mother, experienced it with your husband.
Yeah.
And we can read what you say in paragraph 82. I don't want to ask you to go through that. But you do emphasize that after your husband's death, you spent the first 2 weeks of your widowhood totally alone.
Yes. We were locked down. People couldn't travel.
Yeah.
My best friend, who is anxious that I'm going to say this, but she broke the rules to come and visit because she considered me to be a vulnerable person. And the first time I hugged my brother, I didn't hug my brother when my mum died. And the first time I hugged my brother was on the day of my husband's funeral when my brother had just got out of hospital. When my mum died, that night, my brother and I sat out in my back garden. We were 2 metres distant. We didn't embrace. And that was one of the Downing Street Partygate nights. We stuck to the rules. And my stepdaughter had to self-isolate because she was told that that's what she needed to do. So once she was out of that, then she was my contact. But I didn't have any contact until my friend came.
Well, I think I can probably say, Mrs. Waterton, that your best friend can probably rest easy.
She'll be relieved, Mr. Gale.
You do discuss the impact on your mental health.
Yes.
And again, I don't want to press you to tell us anything that you're uncomfortable with or you would feel any difficulty with. But they have been considerable.
They have.
And perhaps you could just tell us, if you're able to, what they've been.
Yeah, I experienced, after Mum died, I experienced flashbacks, and over and above the feelings that you have during any bereavement, any grief, but we're dealing with, those of us who have been bereaved by COVID during the pandemic are dealing with a traumatic death, and I now realise that some of the experiences I've had during that time were related to that. But I had flashbacks my mood was low, and then after David died, I would quite happily have taken my own life. And actually, once I made that choice, I was going to do that. I didn't know how, but that's what I felt I was going to do. And there was a relief about having made that choice. And obviously, I've moved on, from that. I had very good help from my GP, and I was in the fortunate position of being able to fund bereavement counselling for myself. So I sought a counsellor who could deal with my PTSD and flashbacks, and she dealt with that, worked with me around that in the very beginning. And it took me a long while. I'm still not out of those woods yet. I doubt that I ever will be, because as I say, grief, it's a constant. It doesn't leave you. You don't get over it. You have to manage it every day. And if it hadn't been for very good friends and family, I don't know that I would be sitting here today.
You tell us that in paragraph 91 about grief as a constant.
Yes.
And you also tell us in paragraph 92 how your life has been changed.
Yes. I'm not the same person that I was. No. I don't know that I ever will be. And people ask you how you are, and I usually just say I'm fine. But I don't know that I'll ever be fine again.
No. Well, Mrs. Waterton, those are all the questions that I want to ask you. Is there anything that you wish to add to what's in your statement, or that you would like to expand upon that we haven't specifically discussed?
I think I've made my views around DNR quite clear.
You have.
Over and above that, I've reflected that my mum's GP actually talked about the frequency, that the guidance around testing, infection control processes and so on, how frequently that changed and how difficult it was for them to keep up to date and do the right thing. For me, there's a question about infection control practice in hospitals and whatever breaches occurred that allowed the high rates of nosocomial infection that we've experienced. And I think that's something for the inquiry to pay attention to. And over and above, the inconsistency I experienced in hospitals within the same health board in terms of infection control practice, in terms of care and compassion. And those are the things that I would want the inquiry to pay attention to as it goes forward.
Well, Mrs. Waterton, we are very grateful to you. We realise what an ordeal it has been for you, and we are very grateful for your contribution to the inquiry's knowledge. Thank you very much.
I'm grateful to the Lord to have my voice heard and the voices of those who can't speak for themselves. I'm grateful for that. Thank you.
My thanks to you as well, Ms. Waterton.
Thank you.
Good.
Thank you, my lord.
Tuesday, I think, now.
Tuesday now.
Tomorrow's a public holiday.
It is.
Very good. Tuesday at 10.
Thank you, my lord.